Well, Planetree is a very unique organization in that it was started by a single patient, and a patient who had an otherwise typical experience in a hospital, but came away from that experience feeling that it was worse to actually spend time in a hospital than to almost die.
It wasn't my own experience being hospitalized. I was quite young. I got a mystery virus that never got identified. But after being checked into the hospital, I quickly started to have this anxiety and fear. And I would ask questions and they'd tell me to ask my doctor. They'd give me pills, they'd do things to me that I didn't know what they were.
I think practiced in a Planetree environment is that you're looking at the whole individual as a complete system, mind, body, spirit.
The Planetree model has 10 core components, and each of those components plays out differently in different hospitals. They come up with innovations around these things, but the components themselves have really stayed the same through time.
One thing that we heard over and over that patients want is what we call human interactions. They want kindness.
Our nurses in the intensive care unit recently was working with someone who was a little bit confused, didn't speak English, which is very common in our hospital culture because we are so diverse. And we realized that this poor little lady who was at high risk for falls was upset because she was in the bed so much. So we took the bed actually out of the room, put 2 mattresses on the floor, and this patient was so happy.
We really challenge hospitals to look at the physical environment because there's some very profound but subtle influences on human behavior and the way that we feel based on the physical environment that we're in.
In designing the garden that we're in right now, we wanted to create an image that would be seen by everyone who was going to come to our facility and determine that a garden would be the most effective use, and it would also be in conjunction with the Planetree principles.
Most hospitals are the most intimidating institutions. They're frightening and ugly and plain and scary. So how can we make hospitals be healing institutions, places where when you walk in the door you feel better, which is so different than the way most hospitals are.
So we really help hospitals to look at their nutritional practices, both from the quality of the food, but also access and how it's being delivered.
The reason that it's important for us to offer authentic food to patients here in the hospital that are familiar to their culture is that it's a comfort. You know, when you're homesick and you're not feeling well and your mom brings you a bowl of chicken noodle soup, not only does it make you feel better, but it's a comfort.
Fundamental to Planetree, though, is the belief that if you provide patients with information, they can become active participants in their own care. So we've done that by offering patients information through our Health Resource Center, which is the largest collection of consumer health literature in the country.
Access to information is a key part of Planetree, and they believe that it's important to nourish the mind and spirit as well as the body. So we try to keep patients well informed, and we do that with the open medical record. We encourage patients to look at the record, and if possible, we try to sit down with them and do so. We encourage patients to actually make entries into their patient chart.
One of the things that we look at in terms of the Planetree components is what's the effect on patient safety. We know for a fact that through education we empower patients to care for themselves, and what we see are fewer infection rates. We recognize in the hospital that once the patient leaves the hospital, their care isn't complete, and we know that there's somebody who's going to be taking care of them, whether it's at their home, hopefully at their home, or wherever else they'll be going. And so it's important to involve the family up front.
Our policies allow for family members to be involved in the patient's care. We offer a series of amenities to patients, everything from the kitchens that we have, residential kitchens that we have on our patient units, to unlimited visitation.
Now we know that families are good medicine. So how can we include families in the care? And not only are families good medicine, all the studies show that social support is vital to good health.
Planetree believes strongly in spirituality, and we're not talking about religion here, where religion's based on certain basic principles, but this is more of your inner self, your inner well-being, your basic belief system. And doesn't it make sense that if we can have patients have a positive attitude, that their outcomes will be better?
Patients are not just these broken bodies that come to you to fix. They're individuals with bodies, with emotions, with spirits, with intellect, and you need to engage them on all of those different levels in order to help them to heal. So for many patients, it's not just a physical crisis when they're in a hospital, it's a spiritual crisis.
When you're talking about health care, you're talking about healing. And if we can heal people's bodies, and if we can heal their spirits or their psyche, whatever it happens to be, then it's very satisfying to see that.
Human touch, it's such an important piece for humans to be touched in a caring way. You can convey so much through that. So the hospitals that we work with find innovative ways to bring caring touch back in, and it could be a soft touch program where volunteers are trained to do hand and foot massage for patients.
Whether it's as simple as holding somebody's hand or just touching their arm or just touching them in some caring way, even just putting your hand on their foot when you walk in a room just to say, I'm here and I know you're there.
Arts and entertainment is another thing. Patients also often find themselves either waiting for different tests or treatments or just sort of, sitting in these kind of bare rooms, uncomfortable, in pain, without a lot of distraction. So how we can bring positive distraction into the environment can be a challenge, but many of the hospitals that we work with have found fascinating ways to do that. Everything from clown programs where clowns make rounds on the units, to volunteer baking programs where volunteers will bake muffins and bring them around to patients, to the pet visitation that I mentioned, to arts and crafts programs, volunteers who may bring those kinds of activities into the rooms. Anything that helps to lift the patient's spirit.
The environment, the educational resources, the arts and entertainment program, all make it so much more pleasant to care for patients at our hospital. And those are parameters that Planetree has introduced here.
Part of the Planetree culture believes in healing not only the body, but the mind and the spirit. And complementary medicine is a great way to complement that, and offering such services as aromatherapy, acupuncture, massage therapy.
What about pet therapy? Some of our hospitals even have a patient's own pets program where the patient's own animals can come to visit.
Animal-assisted therapy or pet therapy is designed to be an additional intervention as part of the rehab process. So what we are looking at is using the dogs as a mode to meeting a patient's individual goals so that we can provide another way of achieving what the patients are working on in their rehab program.
The last of our components is healthy communities. How do we bring the community in through volunteers and bringing in schools and getting kids involved in healthcare early on? And how do we go out into the community so that it really is healthcare without barriers, healthcare without walls?
definitely a therapy for me. You can't beat it. It keeps me going because if it wasn't for that, I would be sitting in a chair, watching the boob tube all day, wasting my life. All I do most of the time is play the guitar, and I enjoy it very much. And I know other people do, so it makes us both happy.
We do focus group work and we listen to patients. We ask them to describe for us, what do you feel would be the ideal healing hospital experience?
I think that the biggest difference of all is that in this hospital, you're not a number. Mm-hmm. You're treated with a very personalized way.
I found the most comforting thing about being here, it was the people, the staff, the doctors, the nurses, the entire medical staff treated me as an individual. I was not a number, I was not a case, I was me, a person.
The Planetree retreats are really exciting. We give heated neck rolls and baked cookies and create the ambiance that we should be trying to create for our patients.
And that's what we find is Planetree doesn't have to cost more money. How much time does it take to call someone by their name? How much time does it take to smile?
In addition to the hospital becoming the hospital of choice for consumers in its market, which ultimately results in improved financial performance, there's a movement nationally for commercial health plans or governmental payers to reward hospitals for better performance.
I'm amazed at what the Planetree organization has done and continues to do. And I'm hoping, and I think it's happening, that it's just going to keep growing.
So Planetree has really influenced some very important things about the patient experience, and I think we're going to continue to do that.